Next is Dr. Sameer Verma. Yeah. Vocal for local comparative study of Indian trifocal IOL and Indian EDOF IOL.
Good evening all. I started using this IOL about a couple of years back, and I was very impressed, and so I decided to do a prospective non-randomized study on it. It was a cataract follow-up study, and to assess the true nature of this IOL. So IOL as an effective tool, we know it provides multifocality, deals with spherical aberration and tackles chromatic aberration, and tries to minimize the effect of PCO, IOL decentration and pupil size. So these are the IOLs on which I did. This is the comfort, this is the EDOF IOL. This has got central 1.5 mm zone that provides the EDOF effect. And this was a multifocal, hybrid trifocal that I did. And this was in those cases which had got more than 0.75 diopter of astigmatism. I used this toric lenses, which has got a very nice lock haptic that helps in the proper centration of the lens. So study design was a prospective non-randomized study, single surgeon, single center study, bilateral, unilateral implantation of these IOLs. Primary outcome measures for visual acuity, defocus curve, contrast and adverse events were collected. Inclusion criteria was normal, and I will skip some slide because I have got less time. And these were the exclusion criteria. So the uncorrected visual acuity, as you can see, distance visual acuity is very good. Out of 43 cases, 40 cases were 6.6, and out of 34 cases, 32 were 6.6. And then intermediate visual acuity with the EDOF lenses was quite good, because in more than 31 cases out of 43 cases, the vision was between N6 and N12 for intermediate also. And for near visual acuity, the vision was quite good with extend trifocals, but it was not that good with the comfort with the EDOF one. So the contrast sensitivity and dysphotopsia that I did at 1 month post-op, no appreciable difference in contrast sensitivity was appreciated. And then a questionnaire was used to assess the problem of dysphotopsia and night-time vision. 2 patients of extent with specific complaints of halos and glare was recorded, and night vision problem was recorded in 2 cases of extent. Basically, this lens, this extend lens has got all the multifocal lenses have got an algorithm of how they provide the diffractive rings, and this lens has got an algorithm that depends upon the Gaussian, super Gaussian curve that helps in softening the edges of the rings. That helps in decreasing the dysphotopsias. These are the defocus curve. These are the best and the worst of the comfort lens, and these are the best and the worst of the extend trifocals. And the spectacle independence with the extend trifocal was almost 90%. And for the attack comfort, you can see more than 35 cases have addition of, for near there was addition of only from 1 diopter to 1.5 diopter only. So the attack comfort, the thing is, it has got a 2.5 diameter zone, 2.5 diopter zone. In the 1.5 millimeter zone, there is a 2.5 diopter add is there, and it combines the progressive EDOF technology with monofocal for clear sharp focus for distance, excellent intermediate and functional near vision. This is there are 2 important things about this extend trifocals. That is the central refractive zone, that is clear of any diffractive rings, that is 1.2 millimeter zone, and that provides that deals with the challenges that are related to pupil size, tilt and decentration. The other thing about this lens is that is very important is the Gaussian profile of this lens. The diffractive rings have got the Gaussian profile that is there in the blue, and it provides almost light transmission that is about 92%. That is because of this Gaussian profile that these trifocals provide very good distribution of light between intermediate, near and distance also. And since there are no sharp edges, the problem of dysphotopsias are also very much minimized. It gives equal distribution of light at near, intermediate and distance, and dynamic distribution of light in mesopic and photopic conditions. So continuous vision from 33 cm to distance and 3% of light transmission to retina, and MTF shows a wider zone of all three peaks, and energy loss significantly decreases with increase in pupil size. So the limitations of this study is about the pseudo accommodation that should be ruled out in all cases of multifocality. So pupillometry, spherical aberrations and higher order aberrations were not considered. So that doesn't deal with the pseudo accommodation that can add to the results. And the second thing is a more detailed study of contrast sensitivity with CSV 100E chart could have given better analysis. I did it Pelle-Robson chart. The limitations, IOL decentrations and PCO rate were not considered in outcome measures. So the conclusions can be both of these IOLs are good options as presbyopia correcting IOLs post cataract surgery. Depending on patient profile and lifestyle, both of these IOLs can play a significant role. And the compromise on night vision and dysphotopsia of trifocals and EDOF IOLs can be revised with optical and biometric innovations. And a better study of presbyopia correcting IOLs should include pupillometry, wavefront measurements, and to give better analysis of outcomes. And last but not the least, if at all the cost is a factor, then this lens surely holds some promise. Thank you.
Thank you. How many patients were enrolled in your study?
This for the trifocals I used 43 cases, and for comfort the EDOF I used 43 cases, and for the trifocal I used for comfort I used 43 cases, the EDOF one, and for the trifocal I used 34 cases.
Right. Thank you.